Hey everybody, Tony DeFranco here. It's Mental Health Awareness Month, and we've been recording a series of videos all week. And today I want to specifically address healthcare providers, and specifically two groups of healthcare providers. One is healthcare providers who treat people with any level, any type of mental illness or mental deficiency or difficulty. The other is any healthcare provider who has been on the front line of the COVID crisis, no matter what it is that you do. Be talking to the two of you today, and looking forward to a great conversation. Well, the day cleared up well enough for me to go outside and record the next portion of this message, and I want to address this to healthcare providers who provide services for people with any kind of mental health deficiencies. So whether you're a doctor, whether you're a therapist, psychologist, psychiatrist, counselor, whether you work in any capacity at a facility, clinic, practice that provides resources or help for people with mental health disorders on any level, this is for you. First of all, I would certainly say thank you for everything that you do. People like me would not have made it as far as we have and been as successful in life if it weren't for you. There's no way that I can advise you on how to do your jobs or how to run your practices. I have no experience as a healthcare provider. I do have 20 years of experience in marketing, and I have a lifetime as somebody who has worked with, has dealt with major depressive disorder and generalized anxiety disorder. And here's what I can tell you about this time. You know already that we are in a mental health crisis in America, and that's partially due to the COVID crisis. I've mentioned before that recently a Kaiser Family Foundation found that nearly 50% of respondents have said that the COVID crisis has negatively affected their mental health. On the other side, we have more resources available than we ever have at any time in the past for people who are having struggles with depression, anxiety, and other mental health issues. So, but what's happening now is that the need, if we go by supply-demand matrix, the need is far outpacing the growth in resources and in available services. Now, the other thing that's interesting about this is that right now, during this time over these last couple months, as I record this towards the end of May 2020, digital marketing and digital advertising is more effective now than it has ever been at any point in our history, and that's spiked over the last 2 months, particularly social media advertising and marketing. I would strongly advise you, if you are in a position where you run your own practice or you have any kind of influence over the marketing and advertising of your business, I would strongly recommend that you do what you can to promote your services. And if you are not in a position where you can advertise, or you are not in a position where you can influence the advertising and marketing of the practice or facility where you work, then I would strongly recommend that you use your social sphere of influence to encourage people during this time to reach out for help and give them resources. I totally understand that when you're a healthcare provider and you kind of promote yourself as a healthcare provider among your sphere of influence, everybody wants to rely on you for free medical advice, like Rodney Dangerfield, like, hey doc, it hurts when I do this. I know that you got a lot of that going on, but right now it's more important than ever to say, hey, in case you don't know, this is what I do for a living and this is where I work, and these people can help with this. Or you can say, hey, I'm on the I'm on the front lines of this, and I see people who struggle with this, and this, and here's some resources that might be able to help. Or, other things you can do is just share some free content. Like, hey, here's an article about living with anxiety during the COVID period. Use your influence, use your sphere of social influence to get that kind of information out there. Because here's what I can tell you from being a person in my position. the more exposure we have as people who struggle with mental health issues, the more exposure we have to various types of resources, the more likely we are going to be to grab onto one of those resources. Because, there's going to be 1,000 things we're going to see that we don't connect with, we don't care about, or just happen to be at a time that we don't want to look. But there's going to be that one time that we're in the frame of mind that we want to look, that we want to reach out. And it's important that when that happens, that there's something there for us to reach onto. So don't feel bad about flooding us with information. Don't feel bad about spending some advertising dollars right now to promote your business or practice. Now is the time. If you are a healthcare provider providing services for people with mental health disorders, now is the time for you to be getting the word out more than any other time. Now I'd like to address healthcare providers who have been on the front lines of the COVID crisis, no matter who you are, what you do, no matter what area you work in, whether you're a doctor, nurse, lab tech, whether you're in an ER, whether you're in a clinic practice, private practice, hospital, no matter where you are, what you're doing. I want to talk to you for a minute because it's been real. First of all, the things that I initially heard from my friends who are healthcare providers on the front line just scared the bejeezies out of me. I mean, to hear stories about nurses who weren't allowed to wear masks at work, and lack of resources at work, and all of the stress and anxiety that was going on with our healthcare providers. You people are already working ridiculous hours and sacrificing so much for us as it is. And what's been happening is, my concern is for you that you're pushing those levels from stress where you normally live to distress where many of us are or have been during these times. And I've read several stories of healthcare providers, nurses, people working in the ER who have no history of mental illness committing suicide during this time. So I just want to do a couple things. First of all, I want to thank you for putting yourself in harm's way and doing what you're doing. I've heard from doctors who have said, I'm out here doing what I'm supposed to do, and I have no idea if I'm carrying a virus or not. And I just can't imagine living with that every day. That must be difficult. And but if not for you, more of us would be dying, more of us would be sick, and we need you doing what you're doing. The other thing is, please take care of yourself. Please take care of your family. Please let people around you take care of you. It's difficult when you're the caregiver sometimes to accept care, and I understand that because my nature is as a caregiver. So sometimes it's difficult to ask for care or to receive care when you're the caregiver. Please go out of your way to try to make that happen. Maybe you need to do that professionally. And again, I know as a healthcare provider, sometimes there may be even more of a stigma around, if people know that I'm talking to another mental health care professional, then whatever you need, do to take care of yourself. You have to, the old proverbial, you got to put that oxygen mask on your face. If you're going to help somebody else put the oxygen mask on their face. It doesn't do us any good if you're dead or sick. It doesn't do any of us any good if you are present and absent in the emergency room. We need you to be there. We need you more than anybody else to be healthy and to be well. Please do whatever you can to take care of yourself. So I had planned all along on being able to shoot these videos outside on my back deck. And today's the first day that the weather is semi-cooperated. It's still very overcast. The sun is trying so hard to peek through the clouds, and it just can't do it. But today's the first day that it's not raining, and we're going to have more rain. So I'm going to take advantage of being here right now. But I just wanted to say thanks for tuning in, and to remind you that I'm going to post another video tomorrow at 3:30 p.m. Central. That it's going to be a lot of fun. I hope all of the audiences that have watched any of these videos so far tune in to our Friday video. That day tomorrow, I'm going to share a message of hope with all of you, and it's going to be a lot of fun. And so I hope you're there. hundreds of people have been watching these videos now, and I've heard from dozens of people, and it's just, I thought 5 people were going to watch. So the fact that I've heard from dozens is really amazing, and many people have reached out to me and opened up and shared things, and man, that just helps me just as a human being. So thank you for being here. Thanks for tuning in. Looking forward to our conversation tomorrow.